So good morning, I'm Dr. Sourav. Today I'm gonna demonstrate the surface anatomy of superior extremity. First, we will show the surface marking of medial humeral condyle. So it is a bony projection that can be easily felt on the medial side of the elbow. So there is the medial epicondyle. By putting a point here, so this is the surface marking for medial humeral epicondyle. Now the brachial artery. For this we have to take 2 points. The first point at the lateral wall of the axilla. At the lateral wall of the axilla, the junction of anterior 1/3 and posterior 2/3 of the lateral wall of the axilla. So here will be the first point. We can feel the pulse of brachial artery here. And the second point we will take in the cubital fossa, just 1 cm below the bend of the elbow. Here is the bend of the elbow, and 1 cm below here in the cubital fossa, just medial to the tendon of biceps brachii muscle. So how we will get the tendon? For this we will ask the subject to pull against the hand. So the tendon will be prominent. Now after relaxing the hand, we will get just medial to this tendon. Here will be the radial brachial pulse. So by joining these 2 points, we will get the brachial artery. Radial artery. So for the surface marking, we can divide the radial artery into 2 segments. One is the radial artery in the forearm, and another one is the radial artery in the hand. So now the forearm, for the forearm portion, we have to take 2 points. The first point is 1 cm below the bend of the elbow in the cubital fossa, just medial to the tendon of biceps brachii. So here is the first point for the radial artery. The second point we will take at the lower end of the wrist, on the anterior aspect, between the lateral anterior border of the radius, and medially there will be the tendon of flexor carpi radialis muscle. So here we can feel the pulse of radial artery. So we will take the point here. Now by joining these 2 lines, we will get the radial artery in the forearm. Now the radial artery in the hand portion. For this we have to take a point in the anatomical snuff box here. Here is the anatomical snuff box. Just below the tip of the started process, we will take the point here in the anatomical snuff box. Here is the tip of the started process of the radius. At the second point, at the first intermetacarpal space, the first metacarpal bone, here is the second metacarpal bone, and this is the first intermetacarpal space. In the proximal portion of this space, we will take another point, and by joining this, we will get the radial artery in the hand. So this is the radial artery. Now the median nerve. For this, we have to take the point just like the brachial artery and radial artery. The first point in the lateral wall of the axilla, here the junction between the anterior 1/3 and posterior 2/3 of the lateral wall of the axilla. So here is the first point. The second point in the cubital fossa, 1 cm below the bend of the elbow, just medial to the tendon of biceps brachii. So here is the second point. And the third point we have to take in front of the wrist, just between the tendon of palmaris longus and the flexor carpi radialis. So here will be the third point. Now by joining these 3 points, we will get the median nerve. Ulnar nerve. For the ulnar nerve, we have to take the first point here at the lateral wall of the axilla, it's junction between the anterior 1/3 and posterior 2/3. The second point behind the medial condyle, humeral condyle, epicondyle, here is a groove. So in the groove we have to take the second point. The third point we have to take in the pisiform, lateral to the pisiform bone in front of the wrist. So here is the pisiform bone, and lateral to it, that means here is the third point. And by joining these 3 points, we will get the ulnar nerve. Now the median cubital vein. For this we have to take 2 points. The first point at the lateral end of the elbow joint. about 2.5 centimeter below the lateral end here. So this is the lateral end of the elbow joint, and 2.5 centimeter below, that means here we will take the first point. The second point from the medial end of the elbow joint about 2.5 centimeter above here. So then we have to join the first point with the second point. This is the median cubital vein which shunts blood from the cephalic vein to the basilic vein. For the anatomical snuff box, we have to hold the hand like this. So there is the anatomical snuff box here, and these are the tendons of some muscles. So the boundary of the anatomical snuff box. So anteriorly, this is the anterior side. So anteriorly it is formed by the tendon of abductor pollicis longus and extensor pollicis brevis, and posteriorly it is formed by the tendon of extensor pollicis longus, and the roof is formed by the skin and superficial fascia, and the floor is formed by the radial collateral ligament and the scaphoid and trapezium bone.